Okay.
Hello, everyone, and welcome to the Coordinating SNAP and Nutrition Supports to Reduce Child Hunger Grant Opportunity Informational Webinar. This is hosted by APHSA, the American Public Human Services Association, as well as Share Our Strengths, No Kid Hungry. My name is Chloe Green, and I'm the Policy Associate for Food and Nutrition Services at APHSA, and I'll be leading you through this webinar. Just some logistics at the top. You all have been muted for the purposes of this webinar, but we encourage you all to use the Q&A function at the bottom of your screen to ask questions or anything else throughout the webinar. This is being recorded, and the recording, PowerPoint, and any other materials will be sent to all registrants at the end of the webinar. You can advance to the next slide. Today, you'll be hearing from Jillian Meyer, who's the Director of No Kid Hungry Partnerships and Campaign Strategy at Share Our Strength, from Matt Lyons, who's the Director of Policy and Research at the American Public Human Services Association, and from myself. Next slide. Today, we're going to start off by hearing from Jillian Meyer about Share Our Strength, as well as the purpose of this grant and the need for it right now. Then we'll hear from Matt about the grant opportunity and a little bit more about what project proposals could look like. And then I'll go over the timeline and some more logistics for the actual proposal. We'll then have plenty of time at the end for a question and answer session. So again, we definitely encourage you all to continue to put questions into the Q&A, and we'll get to as many as we can at the end. Next slide. And now I will turn it over to Jillian. Thanks.
Thanks, Chloe. Hi, everyone. It's so nice to be on the phone with you today. My name is Jillian Meyer. I am the Director of No Kid Hungry Partnerships and Campaign Strategy at Share Our Strength. Really excited to have some time with you to talk about this opportunity. Please feel free to chat in questions. We're really excited to talk about it, but we're also really excited to see what questions and ideas you have. Next slide. So for those of you that aren't familiar with No Kid Hungry, we're a national nonprofit organization focused on ending childhood hunger in this country. Since the campaign's inception in 2010, we've focused primarily on expanding access to school breakfast, after-school meals, and summer meals. However, with the onset of COVID-19, we really thought critically about the limitations these programs have for reaching kids. In response, the past few months, we've spent some time thinking through what should our approach be to working on things like SNAP and PEBT in addition to other food programs like backpack programs and school and community pantries. So as you can see, what we focus on is ensuring that every child in this country has access to healthy food 365 days a year. We do that through grant making, technical assistance to schools and community organizations, advocacy, sharing best practices, and partnerships. Next slide. This is just to show you sort of the extent of our reach across the country. We have 37 state-based No Kid Hungry campaigns, working with partners and our own staff on the ground to expand access to the federal child nutrition programs. In 13 states, we have relationships with state agencies, gubernatorial officials, and community-based agencies. Additionally, we allocate grants across all 50 states, DC, Puerto Rico, and Guam. Next slide. I don't think this is going to come as a surprise to anyone, but right now, hungry children in the US are facing one of the worst crises we've seen in our lifetime. Next slide. Over the past decade, we have all worked collectively to make real progress in the fight against childhood hunger. And we have made tremendous progress, which I think you can see on this graph. But COVID-19 has set us back. We're now looking at about 1 in 4 households with children facing hunger, and that number continues to rise. This represents a huge leap from the 1 in 7 households that were struggling with hunger back in September 2019. Such a drastic change in such a short time period shows us that many families were truly one lost job or one school meals program closing away from hunger. In response, we've dramatically scaled our funding, our technical assistance, and our federal state advocacy. Since March, our grant making has climbed 500% higher than in previous years. Next slide. We also really want to emphasize that hunger is an equity issue. Before the pandemic hit, our country already had a huge racial disparity in regards to hunger, with it being so much more problematic in Black and Latino communities across the country. Unfortunately, this has only been exacerbated under the COVID pandemic, and it's a lens we must take as we go about doing this work. We must consider the racial inequities in our systems, in our approaches, as we work to combat hunger in this country. Next slide. This is just to give you a little bit of an overview about our coronavirus response. As I mentioned, we've been focused on grant making. We have allocated almost $50 million in emergency grants to over 1,550 organizations. That number will be about 60 million by the end of December. We've been working with community organizations, schools, local agencies, and collectively through the spring and summer, those grantees have served 847 million more meals at 23,500 locations across the country. We're providing local schools and nonprofits with best practices, guidance on staffing, emergency planning, messaging to parents and students, meal distribution, and more. And as policies are quickly changing, we're working with state agencies and the USDA to really help them understand how these programs can operate. We've ramped up our advocacy efforts significantly. The crisis has exposed and strained the fragile network of resources that many families in the US have to feed their children. We've helped shape national policies and program flexibilities to feed children and pass temporary flexibilities to support families receiving SNAP funds and PEBT. We're also working to raise awareness. We have operated annually a summer meals texting hotline, and once COVID hit, we stood that texting hotline back up to reflect all of the open meal sites where families could text their zip code and find the nearest meal site near them. And that's something that will continue to operate as long as we can get data on where those meal sites are. Next slide. No Kid Hungry wants to recognize and acknowledge that while SNAP is new to us, there are decades upon decades of amazing work that has been happening in this country to ensure that all eligible families have access to this critical program. So what we're looking to do is not start anything new. We're not looking to duplicate efforts, but we're really looking to accelerate the great work that's already happening. We want to support those that have been doing this work day in and day out pre-COVID and will be doing it post-COVID, whether that's the state agencies, local government, the nonprofit community, the technology sector. we think the greatest opportunity to accelerate this work is by working in partnership with those that are already doing this, in particular, focusing this on state agencies. Next slide. So just wanted to really quickly touch on why is Share Our Strength doing this and why is APHSA doing this and what are our roles? So we are the grant project funder. We are going to be leading the site selection process, reviewing the proposals that come in. We are going to be convening advisory groups that can pull in technical assistance, pro bono support, help us plan more strategically, and really think about how to take these lessons we're learning and really inform future agenda for collaboration across SNAP and child nutrition programs. I'm going to turn this over to Matt, who will take it from here.
Thanks, Jillian. And hi, everyone. My name is Matt Lyons. I'm the Director for Policy and Research with the American Public Human Services Association. So for the next few minutes, I'm going to kind of go through a little bit more detail the specific grant opportunity. So why don't we go ahead and jump to the next page. For those who may not be familiar with APHSA, we are a bipartisan membership association that represents state and local public health and human services agencies through their top-level leadership. In addition to working with those top-level leaders, we also work with the depth of subject matter experts that support those leaders in implementing the core mission of their agencies. And if we go to the next slide, one of those core areas that we work very closely with is with SNAP directors throughout the country. And that work is housed primarily through our affinity group, the American Association of SNAP Directors. Both myself and Chloe provide support to that affinity group of state SNAP administrators that meet regularly through both a leadership council called an executive advisory council, as well as through coordination with the kind of full network of SNAP directors across the entire state network. And as we have navigated the waters through this pandemic, the kind of heightened response and increased demand and strain on SNAP systems has really amplified the need for that kind of national level coordination across state agencies that APHSA has and will continue to provide support on in the coming months. Next slide. Specific to this grant opportunity, we are really excited to be able to partner with Share Our Strength, No Kids Hungry to provide support in administering this grant program. Specifically, as Jillian mentioned, this grant is really focused around state level systems that can be leveraged to use SNAP in conjunction with other related programs to increase access to nutrition supports for sustained impact in reducing childhood hunger. I just want to pause and kind of highlight a few kind of pieces of that just as we kind of talk about the really refining focus areas of this project. So as we mentioned before, this is primarily focused on state systems change that can be achieved. So we are primarily interested in SNAP agencies as a lead in partnership with other systems that could be both either peer state agencies or programs within that are housed within the SNAP agency, or with community partners that they work on that align with their state SNAP program. In addition, I want to reinforce that the focus of this grant is around being able to reduce childhood hunger through increased access, so through opportunities to break down barriers between SNAP and other programs to increase access and support co-enrollment strategies and address food insecurity is a primary interest. And lastly, on that point, that we are very interested in projects that can demonstrate sustained impact. So where initiatives can provide some seed resources to lay the groundwork for continued kind of business process transformation that can support ongoing enhanced coordination between SNAP and other programs are a primary interest through this project. With that said, I want to flag that we recognize that states are at very different places with their coordination between SNAP and other systems, and we highly encourage folks from all different iterations of that process to consider applying for this grant. We fully expect to receive and to consider proposals that both build off of existing complex relationships that take those current projects to the next level, as well as organizations that are earlier on in their journey that are laying the groundwork for a long-term vision that this funding can help to support getting off the ground. We also are really interested in strategies that can support more race equitable nutrition support programs. With that, I want to be clear, and we are both interested if there are projects that are looking at addressing an identified need within specific communities or population groups that perhaps may be underserved or have higher rates of food insecurity, or if a program is looking more systemically at the entire SNAP population and with related programs, how those interventions or alignment strategies might look to address ongoing disparities in food insecurity that might exist in your state. Next slide. In terms of the fundamental framework for how we are seeking to provide support to selected projects, there are two main components of the funding that will be awarded to selected sites. First is with staff support. So for the selected sites, funding will be available for either states to hire staffing for overseeing the project implementation period for this grant, or to be able to contract out services that provide that type of staff support that will be needed for carrying out the day-to-day work that will be happening on the ground through this project. In addition, we recognize that in addition to manpower, many of these projects are going to need funding to kind of help support building out the infrastructure you'll need to advance your project. So we are providing highly flexible funding for you all to identify in your proposals what's going to be needed to support the IT, outreach, tools, training that you will need to advance your project forward, and encourage you all to think creatively as to what's really needed to leverage with your existing resources to make that project successful. We also fully expect that state agencies, both the primary SNAP agency that's responding, as well as any partners that are on the project, will have kind of senior level sponsorship within the leadership of organizations. So we are very interested in understanding, knowing that this is a time-limited project, that there is the demonstrated commitment from leadership to make a priority to ensure that your project has the resources it needs and the prioritization within the agency to advance. And throughout the project, we'll be looking to understand how your project team will be supported through your leadership during both that planning phase as well as implementation. Beyond that, I do want to stress that we fully recognize and intend in the scope of this project to offer a high level of flexibility in exactly what services you're looking to coordinate with your SNAP program and how you do so. And we expect that across nutrition programs, whether it be WIC or school meals or PBT or demonstration projects that might be more piloted locally or regionally, that there will be opportunities for you all to identify where you can really achieve great spread and scale and impact through this opportunity. Next slide. I also want to flag that a core component of this work will be cohort learning and cross-site evaluation work that will be ongoing throughout this project. Both APHSA and Share Our Strength are very interested in being able to distill lessons learned from the different project sites and understanding the different approaches and focus areas and what that means for best practices that can inform other states that can learn from this work, policy implications that can help support accelerating this type of work in the future. And accordingly, in your staffing plan, we will create opportunities for peer exchange, as well as for providing access to subject matter experts and resources for each of the leads within your project sites to work together through an ongoing kind of cohort to have that opportunity for peer exchange and learning. Additionally, we'll be looking to bring the group together along with other state agencies to talk about during project implementation where there's potential for more strategic kind of policy alignment, drawing on lessons learned and experiences through these pilot sites in a National Child Hunger Summit. And selected sites will have resources to participate and engage in that summit as well. Additionally, we fully anticipate that there will be plenty of opportunities for selected sites to be spotlighted through conferences, webinars, and other avenues to really draw upon lessons learned for broader learning from the state SNAP and network of other nutrition programs. Next slide. I'll turn it over to Chloe to walk you through some of the logistics.
Thanks, Matt, and thanks to everyone who's already putting questions in the Q&A. Please continue to do that if what Jillian said or what Matt said sparked any questions or as I go through things. So now I'd like to walk you all through what the next year and a half might look like. So in terms of the application process, the proposals are due on Friday, January 29th, 2021, and we plan to award states in February. The actual grant period will be from March 2021 to June 2022 and will be divided into two parts. The first is the planning phase and then the implementation period. So in March, we plan to hit the ground running in the planning phase that will last approximately from March to June. However, this will depend on the state's unique capabilities and situation and will be determined by the state's ability to quickly move the project forward. And during this period, it will involve the awarded states working very closely with their cohort, as well as receiving one-on-one technical assistance from APHSA and other experts in the field to draft and finalize their state work plans and finalize their budget. At the end of this, APHSA will produce an interim report just talking about the general insights, findings, and plans for the implementation period. The implementation period will last a year between approximately summer 2021 to summer 2022. During this time, we will be onboarding new staff, or that is when the states will be onboarding their new staff to perform the project. And we will also be continuing cohort learning as well as this regular technical assistance. During this year, there will be multiple opportunities for states to share their lessons learned and what the work that they're doing. This includes the Child Hunger Summit that Matt mentioned that will be in August 2021 for state SNAP and child nutrition agencies to talk about advancing the coordination between these programs, as well as other various opportunities such as case studies, webinars, and more to share insights. Beyond the grant period, APHSA, Share Our Strength, and the awarded states will continue to disseminate and share their lessons learned as states across the country continue to advance the coordination between these support systems. Next slide, please. Now I'll just talk a little bit more about some of the logistics of the proposal as are outlined in the RFP. Next slide. So Share Our Strength plans to fund between 3 and 5 state agencies, and the grants will range between $200,000 and $350,000 per state. Again, the grants will be finalized and worked through during that planning period of the grant. Next slide. In general, the proposal will include a cover sheet, a project narrative, a budget narrative, and letters of commitment. Now I'd like to go through just a bit more in depth about what we're looking for in the proposal. So in the project narrative, the summary should include the proposed concept, the problem that will be addressed, and the impacts that you expect it to have on your state systems and families with low income in your state. The problem identification section should explain the reasons why your state wants to do this work and why it's important. It should include information about current systems or enrollment of children in nutrition programs, any current work that your state is doing on this, how families and children of color have been disparately affected in your state, and what barriers have been presented in your work thus far. Any data or evidence that the applicant can show to support these statements is highly encouraged. In the proposed approach, this should outline what approach your state plans to take in order to advance the coordination between these nutrition support programs and SNAP. This should include, but is not limited to, which state agencies will be involved and how they will work together, which systems will be modified or changed, how any current work would be uplifted, and how communities of color would be intentionally included from the beginning phases of planning in this program. It should also identify any problems or hiccups that the state foresees in the implementation of this grant. Finally, the section should address how the public health emergency has affected or modified, if at all, the outlined planned approach. The anticipated outcomes should describe what your state hopes to achieve throughout this project and at the culmination of the grant, and how the outcomes will be sustained after the grant period ends. The section should also address how the state plans to track outcomes and how they plan to share them with Share Our Strength and APHSA and others. Moving on to the project team section, as Matt talked about, to make this project work, it is essential that states collaborate across agencies and work well together. This section should go into detail about who will be involved in the project, from what departments and agencies they are, and what their role will be throughout the project. It should also include who will be responsible for managing new staff and how the new staff will be integrated into the project and how they will be supervised throughout the project. And finally, for the timeline, this should be a general timeline that gives an honest estimation of how long it will take the state to stand up what they have outlined in the narrative. The budget narrative, as Matt talked a little bit about, should address what areas the state anticipates they will need funding for. This includes, but is not limited to, staffing, IT systems, and more, and should include both direct and indirect costs. The details of this budget will be combed through and finalized during the work plan development in the planning phase with the support of APHSA and other advisors. And finally, for the letters of commitment, as we have talked about, the SNAP agency will be the primary applicant, but as other agencies are involved, there must be letters of commitment provided from each additional agency that's included in the project plan. It is optional for applicants to also include other letters as relevant, such as from community partners or other higher-ups in the state government. Next slide, please. So, a bit about the eligibility and selection criteria that's outlined in the RFP. To start off, the applying organization must be the state SNAP agency, and they will be strongly preferred to be able to accept grant funds from Share Our Strength, as well as have the capacity to hire, onboard, support, and embed the new staffing resources into their agency. In addition, when reviewing the proposals, the selection committee led by Share Our Strength will also take a special interest in looking at how the proposed project considers and intentionally includes communities of color and others disproportionately affected by hunger from the start of planning throughout the project and through its sustained impacts. Some other important components include a demonstrated interest in collaboration. This is a cohort learning project, and this includes collaboration across this cohort with APHSA, with Share Our Strength, and with these other advisors as recommended. The demonstrated ability to continue moving this work forward in a sustainable manner after the grant period will also be important to demonstrate. And next slide, please. We will now move on to the question and answer session. Thank you to those who have put in the chat. Please continue to do so. I will start off with one question that we got. So there's, can a local or tribal agency apply for this grant opportunity? While we recognize the importance of local and tribal agencies in supporting their communities to access nutrition supports, the primary applicant must be the state SNAP agency. So we encourage any interested local or tribal agencies to reach out to their state SNAP agency and see if there's opportunity for collaboration. The next question will be for Jillian. So how are No Kid Hungry state campaigns involved in this project? And will No Kid Hungry's level of involvement in a state affect grant award decisions or likelihood of funding?
Those are both great questions. I'll answer the second part of that first. There's no penalty for not having a No Kid Hungry campaign or presence in your state, or even for not, if you have one, for not working with them. SNAP is a very new area for us, and we're really looking to learn and support. And so while we're doing this in conjunction with No Kid Hungry and under the banner of No Kid Hungry, being a part of the campaign, working with the campaign doesn't affect this project specifically. So just want to assure folks, even if you've never heard of us before, that is okay. And then I will say, so we coordinate internally with all of our No Kid Hungry campaigns so they know about this grant in case they are working with you and you had questions. And we've already had a few requests to brainstorm and talk about potential ideas following this webinar. That's something we're happy to do. Your campaign is happy to do that with you. I'm happy to join those conversations. Our goal is to be as transparent and supportive in the lead up to this as possible. So please let us know if we can be helpful.
Thanks, Jillian. I'll also just add from the APHSA side, if there are states who work with us regularly or are a part of ASD, please feel free to reach out with us to us. Even though we aren't part of the selection committee, we are happy to help brainstorm or think about if your idea fits into the scope of this project. Another question is, are there any project expenses that grant funding cannot be used for? As outlined in the RFP, the expenses should be reasonable and clearly justified as directly related to advancing the project, but there are not any categorically unallowable expenses.
And I just
So
wanted to add on to that, you know, in the planning process, we think that this will probably be iterative and that the budget you submit may not ultimately be the budget that ends up governing the project, and that is okay. We're not expecting what you submit in January to be written in stone, and it is what it is. And particularly to Chloe's point about unforeseen outcomes or barriers, we understand that's likely to happen even with the best laid plans. And so just want to assure you that we're flexible on that, and we really think that clear, transparent communication is the best way to keep us all aligned and make adjustments to the budget and the plans as necessary.
Thanks, Jillian. Matt, I'll turn a question to you. Will proposals that address PEBT be considered? And do you have any suggestions for how to build off of PEBT in a possible project?
Sure. So the short answer is yes, with a couple caveats. I think we fully understand where states are at, still very much in emergency response, and we want to be attentive through how states may be able to leverage this grant opportunity to support some of the rapid response needs that they are deploying in communities. So to the extent that this funding source can be used to advance some of those priorities, such as PBT, we encourage you to look at that, though you are not required to do so. With that said, I do want to draw to a couple of key considerations there. First, I want to be clear that you should be mindful of ensuring that any funding that you're proposing through this project that is being put towards supporting PBT implementation, consider what is allowable through the 100% federal reimbursement that FNS has made available, and we would encourage any costs that would be allowable there should be submitted for federal reimbursement. Additionally, I do want to reiterate that Our ultimate interest is to be able to demonstrate sustained impact in coordinating and aligning systems in the long term. So opportunities where you are able to leverage this grant opportunity to support working through some of the enhanced coordination and data linkaging that you are doing right now, and that has implications for longer term systems alignment between your SNAP and, in this case, your child nutrition school meal programs, that you can draw out lessons and use this grant opportunity to continue that work beyond PBT implementation. We would be very interested in understanding how you hope to make that connection through this grant opportunity.
Thanks, Matt. The next question is, many states are under a hiring freeze related to the economic crisis affecting state budgets. Exceptions can be made based on the focus of the proposed position. If a state has a compelling application, is there a different weight given to contracted positions or direct staff listed in the proposed program? This application does not require that you, or the proposal does not require that you contract staff. However, it does offer the staffing resource, as we believe it would take a decent amount of someone's time and position to make sure that this work is going strong. If you feel that there is someone or the capability already in your state and need funding for to move this project forward, I believe that those proposals would be considered. Would Matt or Jillian like to add on?
Yeah, I'll just add real quick. So the vehicle that respondents use to provide their staffing support, whether that is as a state employee or through a contracted support, will not affect the review of your application. What we are interested in is understanding your ability to, your timeline for being able to procure the staffing resources that you will need. And we encourage you all to work to submit kind of reasonable assumptions on what your timeline is to be able to onboard those resources through whatever contracting mechanism that you do use. We are interested in projects that would be able to ramp up their implementation periods by at least this summer, so that there's sufficient time for implementation. Although projects that are able to get stood up in a shorter time window, or would have the ability to have direct impact on some of the kind of immediate COVID response need as well, where there's value in that shorter term response, we encourage that as well.
Thanks, Matt. Thanks everyone who's submitting questions. Please continue to submit those as they come to you. Matt, I'll turn to you. Are there there's some examples of other proposals or ways that people could use this funding that you can talk about?
Sure. So I think, as we mentioned before, there really is broad flexibility, and we encourage you to think about what is the most strategic priority that you can advance that's focused around addressing child nutrition and reducing child hunger through enhanced coordination. And with that said, some examples that are certainly not exhaustive, and we've spoken about PBT, so I won't reiterate that, although that remains a line of coordination that can be explored through this grant opportunity. We are also well aware of ongoing opportunities for coordination between SNAP and WIC programs, and the potential value on aligning referral processes or online applications between those systems. So that's certainly a line of opportunity that could be explored further through this grant opportunity. School meal coordination with SNAP as well, even outside of the PBT model, is certainly an area that could be explored. Looking at your process for example, performing direct certification using SNAP, and if there are opportunities to modernize that process and coordinate between your schools and education and SNAP system to increase your rate of certification that you're able to perform through that process. There are certainly a number of pilot projects, whether that's summer EBT or other demonstrations that are ongoing that could be evaluated. Online purchasing is another opportunity that we know that not just SNAP, but other systems are exploring as well. I also want to say that it does not have to be a single program specific coordination. This could, we would also are interested in exploring opportunities that might look more at a macro level, understanding alignment between nutrition systems. So states that are interested in analytics to be able to have some centralized methods of exploring their administrative data across nutrition programs, to do some targeted analysis of where there are gaps in co-enrollment and where there are opportunities to design targeted campaigns to increase enrollment based off of that. These funds could also support an initiative like that as well.
Thanks, Matt. All right, well, looks like there are no more questions. Matt or Jillian, I don't know if you'd like to add anything else before we close out.
I just want to thank everyone for joining today and for your time. Oh, great timing with my children coming up the stairs. Just want to say thank you. We know your time is so valuable, and it's hard to carve out the time for things like webinars, but it was wonderful to connect directly and to hear some of your questions. But please know that we are definitely having this with an open door policy. If you want to chat via email or find some time to connect directly, we are more than happy to do that. Would love to accommodate your schedules.
Thanks so much. And again, here is my contact information. It's also listed on the RFP. If you have any questions at all, feel free to email or call, and we are happy to talk more. And thank you again, everyone, for joining. Have a good rest of your day.